evening, which focused on a stroke awareness campaign.
Today we are having a stroke awareness campaign under the title Enough Time. It's organized in collaboration between Kuwait University medical students, the Ministry of Health and the organization of loyac. We're trying to educate the public about the risk factors of stroke and how to avoid them, and how to recognize a stroke through recognizing its symptoms and highlighting the importance of time in the setting of a stroke, because time equals brain cells that are lost. So once you are able to recognize a stroke, you should be able to call an ambulance or take the patient to the hospital as soon as possible. This is in addition to emphasizing the role of other services such as physiotherapy and occupational therapy in the rehabilitation of a stroke patient. We chose a stroke because it's very relevant to our community, as it was found that stroke is the second most common cause of death in Kuwait.
I'm over here to spread awareness about strokes, and I'm volunteering here today because I feel that more people should be able to volunteer and spread awareness about this issue. And I feel that a lot of people here are affected by strokes, but not a lot of people know about it, which is why I feel it's important to spread the message of strokes. I am volunteering in the physical therapy aspect of strokes, and I would like to, so physical therapy starts 24 hours after a stroke or 7 to 10 days after the stroke, depending on the type of stroke. And it basically helps the patients get back to their community and to regain physical activity after they've had strokes. And physical therapy is a very important part of treatment of strokes, and more people should know about it, and this message is very important to spread around Kuwait, and I feel it's very important.
It is really my great pleasure to be a small part of this today's event, which is of extreme importance. So, because everybody needs to be fully aware of the importance and the consequences which stroke carries, not only for the person suffering, not only for his family, but for the complete society. Because the burden of after-stroke treatment is huge. So it is necessary to be very well aware of what the stroke is, to be very well aware that the vast majority of strokes are treatable, and that the patient's family, and the complete society can benefit a lot from the treatment. Being a radiologist, interventional neuro, our task is to deal with the causes of stroke, and doing that with the so-called minimally invasive way. Which means that we are not performing plastic surgery. There is no opening of the skull, no exposing of the brain. We are using blood vessels as our entry door and our working space for the treatment of either aneurysms or ischemic stroke, meaning that we are doing a puncture at the groin region of one of large vessels, then using a small tube to go through the blood vessels all the way up to the brain, and then if there is a bleeding, we are using devices named coils to occlude the aneurysm and to stop the bleeding, or there is a possibility, if there is something which is blocking the flow inside the blood vessel, such as thrombus, to evacuate by the same means of percutaneous approach. The advantages of this so-called minimally invasive treatment are first of all, that the aggression on the organism of the patient is much less in comparison to plastic surgery, so patient is ready to come back to his normal life.
Welcome back to the studios of Hala Kuwait for our second interview segment of the evening. Right now we are joined by Ms. Azza Ali Al-Uwaid, who is a medical student in her 6th year at Kuwait University, and Mr. Hassan Khalid Ashkanani, who is also a medical student in his 6th year at Kuwait University. First of all, Hassan and Azza, thank you for joining us.
Thank you so much for having us. We're really honored to be here.
It's an honor to have you as well. So we were just watching a report on stroke awareness campaign. So I understand you both are part of the team responsible for the campaign.
Yep.
Tell us more about the campaign.
Well, the campaign started 2 months ago. It was started as an idea where Dr. Yasser Abul Hassan, who is a consultant in ICU, he saw patients that had their life affected by stroke. He saw the outcome. So he was really encouraged to talk to the public. Because if you can actually notice the signs, the symptoms of a stroke event, you can help the patient live a normal life.
Right. So Hassan, what personally inspired you to join this campaign?
I was personally very motivated to join this as even as a student, I saw people coming with past events or even recent events of stroke. And I can see how their lives are affected forever because of these couple of minutes. So, and these couple of minutes cause something that is very permanent in their lives.
Right.
And they're very preventable with easy measurements if they can be noticed by the public.
Right. And not only does it affect the patient, but the people surrounding the patient as well.
The entire family.
Right. So as you said, you've just started 2 months ago. Tell us more about what you've done so far.
Well, it took us a lot of hard work. Both came from Kuwait University, medical students, and what was so interesting about it is that we got people involved from all around specialties. There were people that coming from different fields in university, coming from loyac organization, represented by Ms. Yusra. They really worked hard to understand this disease so that we can help each other deliver this message to the public.
Right, so you're saying collaborative efforts are very important. And they're
because we
critical to your
believe that
campaign.
not only medical students are responsible to save people's lives, everyone is responsible to save their own life and their family as well.
That's very true. So Hassan, tell us more about the different committees under the campaign and what each one does.
Yeah, we basically have subdivided the campaign into 4 committees. We have the volunteer committee, which is responsible for picking and choosing the volunteers who were gonna work on the campaign. We had a very diligent process in picking our volunteers. We wanted, like basically for medical students, we chose students in their clinical years who were already exposed to patients who had clinical experience and knew about stroke, because our campaign aimed to teach the public. So we wanted people who were going to be teachers.
Right.
That was for the volunteers committee. We also had the scientific committee that was responsible for the scientific program that was going to be taught to the volunteers. We also had the logistics committee, which micromanaged everything and made sure that there was smooth communication between all the other committees.
And where do you guys work? What parts do you take up?
We are in the 4th committee, which is the media committee.
Okay.
Yeah. The media committee was basically responsible for public outreach. We were responsible for the designing process of the logo for the campaign and for designing the booth that we had in the Avenues campaign. And we were working on social media to reach the public to make them aware about both stroke and the campaigns that were happening.
Right.
Yeah.
So Azza, obviously all 4 different committees are vital to the success of a campaign.
Yeah.
So tell us more about how you collaborate together and just how the campaign is given to the people of the state of Kuwait.
Yeah, well, we all worked together. We had frequent meetings where we communicated with each other. We said, like, what are the ideas that would we like to present to the public? We needed to focus on certain areas when it comes to stroke. For example, how do we know, how well do people know about stroke? And
right. So you obviously have been taking up collaborative measures. Tell us more about those specifically with your university and perhaps the Ministry of Health here in the state of Kuwait.
Yeah. For the university, we had the majority of the volunteers be medical students. Specifically, we chose sixth-year medical students as other than being exposed to clinical experience, they rotate in the anesthesia and ICU in the hospitals. So they are exposed to patients in very acute scenarios. So they are very aware about it. That's basically for the university. And for the Ministry of Health was very helpful with us. They provided us with very helpful videos that were able to teach the public who even didn't have any, let's say, literary knowledge about stroke, like no textbook knowledge, about how to recognize a person who is having a stroke, you feel me? And they also provided us with the booth that we had for the campaign. It was provided and funded by the Ministry of Health.
Right.
We also had loyac that helped us very much, providing several things, including very helpful volunteers and yeah.
Well, and if anything, just the support is enough, right?
Yeah.
Now we're talking about strokes and stroke awareness. I find it vital to ask you what the symptoms are of a stroke. So if you would share that with us, please.
See, this is the interesting part. When we actually went for the outreach, most people confuse stroke with heart attack.
Aren't they the same?
They're not the same.
Is it a brain stroke and a heart
Yeah,
attack?
see,
Okay.
it can be easily confused, and you can't blame them, you know. People believe things they read online, so this is what we needed to target, this area. See, sometimes the stroke symptoms, they're not so obvious and as dramatic as they show in the movies or in the series. Sometimes it's only like lasting for less than 30 minutes. And this is really important to recognize as well. For example, when the whole face of the patient goes numb, or when he feels like half of his body feeling a weakness, or maybe he loses the ability to speak. So when we help people notice these symptoms, they'll take the patient faster to the hospital.
Right.
Yeah, sometimes it could be a stroke, but it's not noticeable. It's not always dramatic.
Right. So Hassan, what do you think is the most important thing people should know if they feel like they're around someone who's facing a stroke? Especially because you said you have to get them to the hospital very quick.
Yes. They need to recognize a person who is having a stroke. They need to recognize the symptoms of a person having a stroke. If they notice that someone basically is at risk of stroke, maybe old age, hypertension or high blood pressure, a person with diabetes, any person who is at risk of stroke and they see them, they're not themselves. They tell them maybe I'm going numb or I'm feeling very weak, or they notice that they can't talk.
Right.
Time is of the essence in this case. They need to take them as soon as possible to the hospital, and they need to help them because that action can change their lives. It can keep them being healthy.
Right.
Yeah, and prevent
We have a
long-term
common
effects.
saying, it's called
What is it?
time equals brain.
Time equals brain.
The less time you take to take the patient to the hospital, the more you're going to protect their brain function, the more you're going to help them live a normal life.
That's very true. And Azza and Hassan, thank you for your time and all your efforts in helping change and protect people's lives.
Thank you. It's our pleasure.
Thank you so much.
Thank you.
We were just speaking to Ms. Azza Ali Al-Uwaid, who is a medical student in her 6th year at Kuwait University, as well as Mr. Hassan Khalid Ashkanani, who's also a medical student from Kuwait University. Let's now head over to our third report for the evening, which is covering drugs awareness.